Question 1. A diabetic client becomes diaphoretic and confused after receiving morning insulin, but before breakfast. What should the nurse do first? A. Administer 50% dextrose, IV. B. Recheck the blood glucose level immediately. C. Give orange juice and recheck glucose in 15 minutes. D. Notify the provider of the hypoglycemic episode. Answer. B. Recheck the blood glucose level immediately. Rationale. The nurse must verify the cause before intervention. Hypoglycemia is likely but must be confirmed to prevent unnecessary treatment and identify underlying issues such as delayed absorption. Question 2. A nurse is assessing for clients. Which finding requires immediate intervention? A. New onset confusion in an elderly client after surgery. B. Pain score of 8 out of 10 after analgesic administration. C. Oxygen saturation of 90% on 4-liter nasal cannula. D. A client refusing to ambulate post-operatively. Answer. C. Oxygen saturation of 90% on 4-liter nasal cannula. Rationale. Hypoxemia is life-threatening and indicates impaired gas exchange or respiratory failure, addressed before pain or mobility concerns. Question 3. Which task is most appropriate for the nurse to delegate to unlicensed assistive personnel when managing an unstable cardiac patient? A. Assisting the client with toileting using a bedside commode. B. Monitoring for chest pain during ambulation. C. Reporting chest discomfort to the nurse immediately. D. Assessing heart rate after ambulation. Answer. C. Reporting chest discomfort to the nurse immediately. Rationale. Unlicensed assistive personnel can observe and report but cannot assess. Early reporting ensures timely RN evaluation of cardiac instability. Question 4. A postoperative patient suddenly complains of severe abdominal pain, and the wound dressing is saturated with bright red blood. What is the nurse's priority? A. Apply firm pressure over the wound. B. Elevate the head of the bed. C. Call for help and apply sterile dressing. D. Obtain vital signs and notify the surgeon. Answer. C. Call for help and apply sterile dressing. Rationale. Rapid response prevents contamination and fluid loss. Sterile coverage is critical until surgical evaluation. Question 5. A unlicensed assistive personnel attempts to transfer a patient with orthostatic hypotension without assistance, and the patient nearly falls. What is the nurse's best action? A. Re-educate the unlicensed assistive personnel on safe transfer technique immediately. B. Assist the patient and perform a full assessment. C. Report the unlicensed assistive personnel for unsafe practice. D. Instruct the unlicensed assistive personnel to complete the transfer with help. Answer. B. Assist the patient and perform a full assessment. Rationale. Patient safety and assessment come first. Coaching or reporting follows once safety is ensured. Question 6. During a disaster triage, which client should the nurse tag as immediate red? A. A client with second-degree burns over 20% of the body. B. A client with open femur fracture and controlled bleeding. C. A client with chest wound and shallow respirations. D. A client unresponsive with no pulse. Answer. C. A client with chest wound and shallow respirations. Rationale. Airway compromise that can be corrected rapidly receives the highest triage priority. Pulseless clients are tagged black, expectant. Question 7. Which client assignment is most appropriate for the LPN in a step-down cardiac unit? A. A client newly admitted with chest pain. B. A client post-cardiac catheterization awaiting discharge. C. A client with chest tube drainage increasing rapidly. D. A client with new onset atrial fibrillation. Answer. B. A client post-cardiac catheterization awaiting discharge. Rationale. Stable post-procedure care fits LPN scope. New or unstable cardiac conditions require RN assessment. Question 8. Before administering digoxin to an elderly client with heart failure, which assessment is most critical? A. Apical pulse and serum potassium. B. Pedal pulses and urine output. C. Lung sounds and oxygen saturation. D. Bowel sounds and abdominal distension. Answer. Apical pulse and serum potassium. Rationale: digoxin toxicity risk increases with hypokalemia and bradycardia. Both must be evaluated before administration. Question 9. A client receiving IV vancomycin reports itching and shortness of breath. The nurse's first action should be to A. Stop the infusion and assess airway. B. Notify the provider for antihistamine order. C. Document the reaction in the chart. D. Slow the infusion rate to reduce symptoms. Answer: A. Stop the infusion and assess airway. Rationale: signs indicate anaphylaxis. Stopping the infusion and airway assessment prevent respiratory collapse. Question 10. A dialysis client reports muscle weakness. Lab results show potassium 6.5 milliequivalent per liter. Which action is most urgent? A. Administer IV insulin with dextrose as ordered. B. Restrict high potassium foods. C. Prepare the client for dialysis. D. Place the client on a cardiac monitor. Answer: D. Place the client on a cardiac monitor. Rationale: cardiac monitoring ensures early detection of dysrhythmias before treatment is initiated. Question 11. Which patient can be safely assigned to the licensed practical nurse under the supervision of an RN? A. Client with fresh tracheostomy requiring suctioning. B. Client 3 days post-appendectomy with stable vitals. C. Client with new onset chest pain. D. Client receiving blood transfusion. Answer: B. Client 3 days post-appendectomy with stable vitals. Rationale: LPNs can provide care for stable, predictable clients. New or high-risk cases require RN monitoring. Question 12. A nurse finds a client unresponsive on the floor. What is the first nursing action? A. Assess for pulse and breathing. B. Activate the rapid response team. C. Call for help and obtain crash cart. D. Begin chest compressions immediately. Answer: A. Assess for pulse and breathing. Rationale: assessment determines whether CPR or further intervention is indicated. Never act without assessment. Question 13. A nurse observes a colleague recording vital signs not taken. What should the nurse do first? A. Privately ask for clarification about the documentation. B. Report to the nurse manager immediately. C. Recheck the client's vital signs personally. D. Document the false entry in an incident report. Answer: A. Privately ask for clarification about the documentation. Rationale: clarifying first maintains professional communication. Reporting follows if falsification is confirmed. Question 14. A patient with pneumonia becomes restless and agitated despite adequate oxygen flow. What is the nurse's priority action? A. Assess for signs of hypoxia or cyanosis. B. Notify the provider to increase antibiotic dosage. C. Reassure the patient and continue oxygen. D. Obtain arterial blood gas results. Answer: A. Assess for signs of hypoxia or cyanosis. Rationale: restlessness is an early sign of hypoxemia. Reassessment directs immediate oxygenation adjustments. Question 15. A client with sudden right-sided weakness is admitted. Which action should the nurse perform first? A. Obtain glucose level. B. Assess airway and gag reflex. C. Prepare for CT scan. D. Administer prescribed aspirin. Answer: B. Assess airway and gag reflex. Rationale: airway protection takes precedence. Aspiration risk increases with neurological deficits. Question 16. A new unlicensed assistive personnel forgets to report a patient's temperature of 102 degrees Fahrenheit. What should the nurse do first? A. Assess the patient for infection or dehydration. B. Reprimand the unlicensed assistive personnel immediately. C. Document the missed report. D. Assign the unlicensed assistive personnel fewer patients. Answer: A. Assess the patient for infection or dehydration. Rationale: patient safety overrides discipline. Immediate assessment prevents deterioration. Question 17. A postoperative patient suddenly develops hypotension and tachycardia. The surgical dressing is dry. What should the nurse do next? A. Check IV line patency and fluid rate. B. Reassess blood pressure in 5 minutes. C. Elevate the legs and notify the surgeon. D. Inspect for hidden internal bleeding. Answer: D. Inspect for hidden internal bleeding. Rationale: absence of external bleeding doesn't rule out internal hemorrhage. Internal assessment guides interventions. Question 18. The nurse assigns vital signs to unlicensed assistive personnel. Later, the nurse notes abnormal results, but no report was given. What is the nurse's best response? A. Recheck vital signs personally. B. Ask the unlicensed assistive personnel to document correctly. C. Report to the supervisor. D. Provide retraining on reporting abnormal findings. Answer: A. Recheck vital signs personally. Rationale: verification ensures accuracy before corrective or disciplinary action. Question 19. A patient's sodium level is 118 milliequivalent per liter, with increasing confusion. What should the nurse do first? A. Implement seizure precautions. B. Notify the provider for hypertonic saline. C. Restrict free water intake. D. Assess deep tendon reflexes. Answer: A. Implement seizure precautions. Rationale: severe hyponatremia increases seizure risk. Safety measures prevent injury while awaiting treatment. Question 20. A client with chest tube drainage suddenly shows 250 milliliters of bright red output within 30 minutes. What is the nurse's priority action? A. Notify the surgeon immediately. B. Assess respiratory status and vital signs. C. Clamp the chest tube. D. Measure total drainage output. Answer: B. Assess respiratory status and vital signs. Rationale: rapid bleeding threatens oxygenation and perfusion. Assessment directs urgent communication and intervention. Question 21. A nurse in the ICU is caring for 4 patients. Which patient should the nurse assess first? A. A postoperative patient reporting pain, level 8 out of 10. B. A patient with sepsis who has a new onset of confusion. C. A patient receiving a blood transfusion with no reactions. D. A COPD patient with oxygen saturation of 91%. Answer: B. A patient with sepsis who has a new onset of confusion. Rationale: new confusion suggests decreased perfusion or septic encephalopathy, requiring immediate intervention to prevent shock progression. Question 22. A nurse is delegating tasks to unlicensed assistive personnel. Which task is most appropriate to delegate? A. Educating a patient about insulin administration. B. Monitoring for signs of hypoglycemia. C. Measuring and recording urinary output. D. Assessing pain after medication. Answer: C. Measuring and recording urinary output. Rationale: unlicensed assistive personnel can perform routine measurements, but not tasks that require assessment, evaluation, or teaching. Question 23. A nurse receives 4 reports during shift handoff. Which patient should be seen first? A. A patient with type 1 diabetes who missed breakfast insulin. B. A patient with heart failure with crackles and shortness of breath. C. A post-appendectomy patient with mild nausea. D. A patient waiting for discharge education. Answer: B. A patient with heart failure with crackles and shortness of breath. Rationale: crackles and dyspnea indicate fluid overload and potential pulmonary edema, which can be life-threatening. Question 24. The nurse assigns a new graduate nurse to care for which patient? A. A patient with diabetic ketoacidosis on insulin drip. B. A stable postoperative patient receiving maintenance, IV fluids. C. A patient with chest pain awaiting ECG. D. A patient on high-alert medication requiring titration. Answer: B. A stable postoperative patient receiving maintenance, IV fluids. Rationale: stable, predictable patients are appropriate for a novice nurse under indirect supervision. Question 25. A nurse observes an unlicensed assistive personnel ambulating a patient on oxygen who becomes dizzy. What should the nurse instruct the unlicensed assistive personnel to do first? A. Continue ambulation while monitoring symptoms. B. Return the patient to bed immediately. C. Call the nurse before moving the patient. D. Remove the oxygen to prevent falls. Answer. B. Return the patient to bed immediately. Rationale. Safety and fall prevention are the priority. The nurse should assess afterward. Question 26. A patient receiving blood develops chills and back pain. What is the nurse's immediate action? A. Stop the transfusion and keep the IV line open with normal saline. B. Notify the provider after completing transfusion. C. Administer acetaminophen and continue. D. Send the blood bag to lab after transfusion. Answer. A. Stop the transfusion and keep the IV line open with normal saline. Rationale. These symptoms suggest a transfusion reaction. Stopping the blood prevents further antigen exposure. Question 27. The charge nurse must assign patients. Which should be assigned to the licensed practical nurse? A. A newly admitted patient with suspected stroke. B. A patient requiring wound care and oral medications. C. A patient needing IV push cardiac medications. D. A patient requiring comprehensive discharge teaching. Answer. B. A patient requiring wound care and oral medications. Rationale. LPNs can manage stable patients with predictable outcomes, including wound care and medication administration. Question 28. A nurse notices a drop in a patient's BP after administering a new antihypertensive drug. What should the nurse do first? A. Reassess blood pressure in 15 minutes. B. Notify the provider immediately. C. Place the patient in a supine position and assess perfusion. D. Document the finding and monitor. Answer. C. Place the patient in a supine position and assess perfusion. Rationale. Safety and stabilization precede notification. Hypotension may require rapid physical response. Question 29. Which of the following patients is the highest priority for reassessment? A. A patient with pneumonia with productive cough. B. A diabetic patient reporting blurred vision and sweating. C. A postoperative patient with mild nausea. D. A patient waiting for wound dressing change. Answer. B. A diabetic patient reporting blurred vision and sweating. Rationale. Symptoms suggest hypoglycemia, which can rapidly progress to loss of consciousness if untreated. Question 30. During morning rounds, a nurse identifies for patients needing care. Which should be seen first? A. A patient with postoperative pain rated 7 out of 10. B. A patient with new onset confusion and restlessness. C. A patient requesting assistance with breakfast. D. A patient with mild shortness of breath relieved by oxygen. Answer. B. A patient with new onset confusion and restlessness. Rationale. These symptoms may indicate hypoxia or acute neurological change requiring immediate assessment. Question 31. A nurse finds a patient lying on the floor after a fall. What is the nurse's first action? A. Check the patient for injuries. B. Call for help immediately. C. Assist the patient back to bed. D. Notify the provider about the incident. Answer. A. Check the patient for injuries. Rationale. Assessing safety and injury comes before any movement or notifications to prevent further harm. Question 32. A nurse is caring for a patient with increased intracranial pressure. Which intervention should be delegated to an unlicensed assistive personnel? A. Monitoring for changes in level of consciousness. B. Keeping the head of bed elevated 30 degrees. C. Administering stool softeners to prevent straining. D. Evaluating response to pain medication. Answer. B. Keeping the head of bed elevated 30 degrees. Rationale. Positioning to maintain safety can be delegated, but assessment and medication management require RN judgment. Question 33. A nurse caring for a patient with pneumonia notices a drop in oxygen saturation from 95% to 88%. What should the nurse do first? A. Notify the provider. B. Increase oxygen as prescribed and assess lung sounds. C. Document the finding. D. Recheck saturation in 30 minutes. Answer. B. Increase oxygen as prescribed and assess lung sounds. Rationale. Immediate oxygen support and reassessment address the cause before escalation. Question 34. A charge nurse is observing delegation practices. Which action requires intervention? A. Unlicensed assistive personnel assisting with ambulation of a stable patient. B. LPN monitoring blood glucose before insulin. C. Unlicensed assistive personnel assessing pedal pulses after ambulation. D. RN performing discharge teaching. Answer. C. Unlicensed assistive personnel assessing pedal pulses after ambulation. Rationale. Assessment is outside unlicensed assistive personnel scope and must be performed by licensed personnel. Question 35. A patient with COPD becomes increasingly lethargic with shallow respirations. What is the nurse's first action? A. Notify the respiratory therapist. B. Assess oxygen saturation and apply prescribed oxygen. C. Call the provider for ABG order. D. Document changes in the chart. Answer. B. Assess oxygen saturation and apply prescribed oxygen. Rationale. The nurse must ensure adequate oxygenation before further interventions or documentation. Question 36. A nurse is caring for 4 patients. Which finding requires immediate follow-up? A. A post-operative patient with temperature 99.5 degrees Fahrenheit. B. A patient on heparin with oozing gums. C. A patient receiving antibiotics reporting mild nausea. D. A diabetic patient with fasting glucose 120 milligrams per deciliter. Answer. B. A patient on heparin with oozing gums. Rationale. Signs of bleeding in a patient on anticoagulation indicate potential toxicity or overdose. Question 37. The nurse must prioritize morning care. Which task should be done first? A. Administer pain medication to a patient rating 9 out of 10 pain. B. Ambulate a stable postoperative patient. C. Provide hygiene care for a bedbound patient. D. Change a dressing due at 10 a.m. Answer. A. Administer pain medication to a patient rating 9 out of 10 pain. Rationale. Severe pain affects vital signs and recovery. Managing it first aligns with physiological priority. Question 38. A nurse suspects an unlicensed assistive personnel is falsifying vital sign documentation. What should the nurse do first? A. Confront the unlicensed assistive personnel privately about the concern. B. Reassess the patient's vital signs personally. C. Report directly to the nurse manager. D. Remove the unlicensed assistive personnel from patient care. Answer. B. Reassess the patient's vital signs personally. Rationale. Verification ensures patient safety before escalation of a potential ethical violation. Question 39. A nurse notes a patient's potassium level of 6.2 milliequivalent per liter. What should the nurse do first? A. Document and report at shift change. B. Call the provider and prepare for ECG monitoring. C. Restrict fluids immediately. D. Encourage oral intake. Answer. B. Call the provider and prepare for ECG monitoring. Rationale. Hyperkalemia can cause fatal arrhythmias. ECG monitoring ensures early detection of changes. Question 40. A nurse is delegating to an unlicensed assistive personnel and licensed practical nurse on a medical surgical unit. Which assignment is most appropriate? A. Unlicensed assistive personnel. Monitor chest pain. LPN. Titrate IV morphine. B. Unlicensed assistive personnel. Ambulate stable patient. LPN. Change surgical dressing. C. Unlicensed assistive personnel. Provide discharge teaching. LPN. Admit new patient. D. Unlicensed assistive personnel. Assess pain. LPN. Interpret lab results. Answer. B. Unlicensed assistive personnel. Ambulate stable patient. LPN. Change surgical dressing. Rationale. Each task aligns with a correct scope of practice. Unlicensed assistive personnel for basic care. LPN for stable procedure-based tasks. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.